I wanted to review the Frax score for your recent bone mineral density. The Frax score is a determination of the possibility of treatment with respect to the bone mineral density. Osteopenia or bone thinning was noted. Treatment is recommended when the 10-year probability of a fracture is greater than 20% for a major osteoporotic fracture and 3% for a hip fracture. In your case, the 10-year probability of a hip fracture was above these scores. Medications are recommended to both improve the bone mineral density and lower the potential for a future fracture from osteopenia. DEXA scan. The established standard for measuring bone density is the dual energy X-ray absorption scan, called DEXA scan. This test is performed by passing low energy X-rays through a bone, most often of the lower spine and hips. The scan results will indicate whether a person has normal bone mineral density, low bone mass, or osteoporosis. This particular bone density is the only one that can be used to diagnose osteoporosis and track bone mineral density changes over time. DEXA imaging results include two scores, a T-score and a Z-score. The T-score compares a person's bone mass with the young adults of the same gender. According to the National Osteoporotic Foundation, the scores fall into the following categories: less than 1 standard deviation, normal; -1 to 2.5 standard deviation is low bone mass, called osteopenia, a potential precursor condition to osteoporosis, and less than 2.5 standard deviations typically indicates osteoporosis. Now, the Frax tool has been developed to evaluate the fracture risk of patients. It is based on individual patient models that integrate the risks associated with clinical risk factors such as bone mineral density at the femoral neck. The models have been developed from studying population-based cohorts from Europe, North Africa, Asia, and Australia. In its most sophisticated form, the Frax tool is computer-driven. It gives the 10-year probability of fracture. The output is a 10-year possibility of hip fracture and a 10-year possibility of a major osteoporotic fracture such as the spine, forearm, hip, or shoulder. This is an example of what the Frax score is and how it was calculated. Certain numbers are inputted and a computer-driven number is generated, or risk score. Osteopenia is when your bones are weaker than normal but not so gone so far that they break easily. Bones are usually their densest when you're about 30 years of age. Osteopenia, if it happens at all, usually occurs after age 50. The exact age depends on how strong your bones are when you're young. If they're hardy, then you may never get osteopenia. If your bones aren't naturally dense, you may get it earlier. Recommended medications for osteopenia to improve bone mineral density and lessen fracture include the following: biphosphonates and RANKL inhibitors. The biphosphonates are medications recommended for osteopenia to improve bone mineral density and lessen fractures. They are anti-resorptive agents that are used in the prevention and treatment of postmenopausal osteoporosis. They can help prevent fractures in people at moderate or high fracture risk and prevent bone loss for men and women taking steroids like prednisone. Biphosphonates work by slowing cells that break down bone, that's osteoclasts, allowing cells to build up bone, osteoblasts, more time to work, and reduce this imbalance. Actinel and Fosamax have been approved by the FDA for the treatment of osteoporosis in men. Available biphosphonates are listed on the next page. There is good long-term safety data on the effects on the biphosphonates, but as many medications, there are also side effects. The most common side effects include muscle ache, joint aches, stomach upset, or heartburn. There has been associated with long-term use a rare side effect called osteonecrosis of the jaw, atypical femur fractures. Here is a list of the available biphosphonates, which include Fosamax, Boniva, and Actinel, in an intravenous form called Reclast. Now, the next medication for osteopenia would be RANKL inhibitor. This is also known as Prolia, which is its brand name, and its active ingredient is denosumab. It is used to treat osteoporosis in women who have already gone through menopause and have a high risk of breaking bones. It belongs to a group of drugs known as rank ligand inhibitors, which prevent certain proteins in the body from breaking down bone cells. It is available in an injection of 60 milligram per milliliter dose under the skin every 6 months. Its side effects include pain in the back, legs, and arms, joint pain, weakness or tiredness, gastric reflux, bladder or kidney infection symptoms, swelling of the feet, ankles, lower legs, rash, and stomach pain. Serious side effects may include allergic reactions, low blood count, high cholesterol, bladder infections, and breakdown in the jaw. Rare side effects include urinary tract infections and infections in the pancreas. Thank you.